Hello, world. Welcome to Africa Let's Talk. My name is Collins Kofi Opo. You can always call me Mr. Beyond. Of course, tonight we have another conversation that we are bringing to you. So please, if you have joined us, do me a favor, share the video, invite your friends, and let's get into this conversation because we are actually going to have a discussion on the updates about the increasing access to career pathways programs, which is being championed by the Global Foundation. So if you remember, a couple of weeks ago, we actually made a presentation about increasing access to career pathway program that is being championed by the Global Fatherhood Foundation with support from the DEED. So this actually program is aimed at professionals who are actually trained immigrant nurses and other health professionals who reside in Minnesota, but they do not meet the U.S. nursing professional standard. There is a program for you, and there's a program for anybody who may have migrated to the United States with some health professional background, but they do not have the required professional standard certification. This program is for you. So please invite others. Let's get together whilst we have this conversation. I would like to bring in Mr. Imwangi. He is the Executive Director of the Global Fatherhood Foundation. Hello, sir. You are welcome to the program.
Well, thank you so much, Mr. Collins. I'm so excited to be here.
Absolutely. All right. So like I mentioned, this program has to do with professionally trained immigrant nurses and other health professionals who reside in Minnesota, but they do not meet the U.S. nursing professional standard. In the first place, we want you to throw some more light on this program, its origin, the idea behind it. Why is it important to increase access to career pathways?
Well, thank you so much, Mr. Collins. Maybe before I start, let me just introduce myself again. I am Simon Wangi, the Executive Director of the Global Fatherhood Foundation. We are based in Brooklyn Park. And I know some, they're asking me, hey, what do you do? Our mission is to help and guide immigrants, fathers and refugees to have a voice in the community through advocacy, determination, and social equality. So fathers and youth and families, we are here to support you. So let me go back to your question. That's a very good question, Mr. Collins. I think the idea was to address the gap shortage in the Minnesota healthcare industry, because the next 2 to 4 years, a lot of people in this profession will retire, and this is going to impact the economy. So through the Minnesota Department of Employee and Economic, that's DEED, and through the input of our community network and advisors and professionals, they decided they should come up with a program whereby to meet this shortage. One of the ways will be to have those people who have international credentials. They are not doing their work, their passion, but we can be able to bridge the gap, support them, give them resources, education, and then they can be able to come to their career. Remember also during COVID, COVID really impacted the state of Minnesota. COVID was new. Most people didn't know. Most people in this profession, they were so stressed. There was so much working, and some of them, they opted to leave this career. So they either they retire or they want to do something different because of the different levels of frustrations here. So
Wow.
I'll say this: the demand of the services in the healthcare in Minnesota is more than the supply.
Wow.
So the program pathway is one of the ways to get people to work and meet also those future shortfall in the state of Minnesota.
Hmm. Wow,
Yes.
that's interesting. So if you heard it for yourself, if you
Yeah.
are if you ever wondered that being an immigrant health
Mm.
professional and how do you fit into the whole mainstream nursing in the United States, especially here in Minnesota, please, there is good news for you and good news for anybody who may be in this situation. Of course, the next thing that I would like to know is that since the program was introduced, the Global Fatherhood Foundation has been actually been in the forefront, championing this program. Can you share with us any updates about this
Yes.
program, which is the Career Pathways program?
Well, thank you. Well, I want to say this: there has been so much excitement in this program. We get phone calls every day. We have people showing up. We get emails. We get mail emails. We have social email contacts. So there's so much excitement. Uh,
Mm.
well, the update about this. The state has decided we should expand our geographical location. We should not just focus on the Hennepin County, Washington County, Anoka, or Ramsey County. And so I want to understand about this program. We have other navigators too. I think we're about like 6 navigators from in the whole of in the state of Minnesota. So,
Mhm.
so we have our monthly meeting, and we decided. I think instead of me being here at the Hennepin County, then I have our African brothers and sisters or immigrant communities. They are based in St. Cloud, or they're based in St. Cloud, or they're based in Duluth. I think I can pass that information to the navigator who are there. They can be able to access them. They can be able to give them all the resources they need from that point, because we are kind of widespread. Because right now, I think I'm approaching. I get calls every day. I'm getting calls every day. So.
Wow.
So it will be nice. I can be able to work with my supporting navigators in what I'm saying to make this project, to make this program a success. We
Mhm.
we have to work with our navigator where they are. So it's going to be easy somebody from Duluth to go to the navigator who is in Duluth
Oh,
and
okay.
get those services here.
Okay, all right. So proximity is actually a big thing here,
Oh yes.
and people are not going to be cut off because of distance or because of the county that they live here in Minnesota. Of course, the next thing that we'd like to find out from you at this point would be what are the different levels in this program in terms of the target population? I would think that there could be some levels in this program. Can you tell us the different levels in this program with regards to the target population?
Well, I want to say thank you again. There are different levels of this program, and number one, like you said, our target are the international professionals
Mhm.
who are credited in their country, but they don't meet the U.S. Requirement here. One of the levels is we have the nursing program itself is on a different component. There's so many options here. We have registered nurses, we have the LPN, we have mental health specialists coming from different countries here.
Mhm.
However, also we do have another level of it incorporates different levels. For example, like the family medicine physicians, the nursing assistant, alcohol and drug counseling, substance abuse counselors, health unit coordinators, physician's assistants. So there's a different level of components within the healthcare
Mm.
industry. What I want to say is this, and I think the most important thing people have been asking me, it's about the process. The process is simple, actually. It's simple, but it can be very frustrating. Yeah, it can be
How,
very frustrating. Yeah.
in what way can it be frustrating? And is there a way you are helping to make it less frustration?
Sure.
Frustrating, actually.
Certainly. So let me just explain. Okay, the process is simple, but can be frustrating. One, we have a profession, because I wanted to look. There's a different category here. We have professions who have decided to go to school, and maybe they want to do it again without going through the credentials. No, it is very tough.
Oh.
You
Mhm.
have professionals who would like their credentials to be evaluated. Yeah, they have,
Mhm.
and this will be demonstrated either by what classes they will take, or it will be demonstrated on where. On what exams or exams they will take for them to be at par with the U.S. Qualifications here.
Mhm.
Now, if you're a nurse, and if you're a nurse, you're coming from an African country. even after your credentials they are evaluated, you still have to take a NCLEX exam. This is a
Mm.
requirement by the Minnesota with the Minnesota nursing board, because it's not it's not like automatic.
Mhm.
There are those board standards that they have to be met also. So uh, to the applicants and the participants, what we are telling them, they should not be frustrated. My
Yeah.
job is to guide them, my job is to support them, and my job is to make sure that they are going easy. And also, I think we'll talk about resources and make sure that all the applications that you're applying, even for the credentials, we are paying for those credentials. They have also credential cost.
Mhm.
Yes.
Okay. All right. Once again, this is African Let's Talk. My name is Collins Kofi Upon. We're talking about the updates on the increasing access to career pathways program, which is actually being championed by the Global Fatherhood Foundation. And this program is helping immigrant health professionals. For example, you were a nurse back in Africa, in parts of Europe, wherever you were, and then you are here, you don't know how to actually begin, or even if there is any chance for you at all. This program is here to support you, and it's been championed, like I said, by the Global Fatherhood Foundation. At this point, of course, we want to find out from you, Mr. Imwangi. Um, for example, if somebody has to start all over again from afresh, maybe they've been in the United States for 20 years and they were a nurse back home, a doctor back home, but they never pursued because of the challenges in the program. I believe there could be some level of uncertainty with what could be in stock for them. What advice or support systems does the program have available for such people who may be considering to get into the program, but then they have a fear of, wow, it's been several years since they did anything with health?
Well, actually, it's true. If you look at the level demographics, also if you look at the age set from different people, if you
Mm-hmm.
take a young man or a young lady who is at 24 years old, or 24 or 25 years old, with a person who's 56 years old, 60 years old,
Mm-hmm.
that's a very big gap.
Yeah.
A very big gap. Yeah. So what actually I'm doing during our outreach, we are telling these people we are a trusted source, and our goal is to make sure that they have the support and the resources. In their resources to make these career navigation successful.
Mm-hmm.
Some of the resources we have, for example, we pay rent.
Mm-hmm.
We pay your rent if you're struggling with that with tuition, not tuition, but if you want to travel, if you need a gas card, we'll pay for that. And some of the people too, because of they have transportation, maybe their car is broken down. I can
Mm-hmm.
be able to look at where, at what amount I can be able to help you with your car, with your cost of your car. So the and other thing with the especially we have a single women or single coming from single homes, men and women.
Mm-hmm.
We can be able to help with the daycare, you know,
Mm.
with daycare. So
Wow.
I know there is a level of uncertainty, but I want to reach out to our people, especially over 45 years old. Don't give up on this program. This is your passion. You had that passion before, and opportunity is here. So try it. Come and talk to me. Come and see us here, because our goal is to make sure that we give you all the support and the resources so that you can navigate, so that you can be able to go back to your passion and be successful. Because honestly, let's talk about these programs, this career. They're highly paying job,
Mm-hmm. Oh
and
yeah.
yeah, they're
Yeah.
high paying job, yeah. And believe me, with the support system also from our the hospitals, the hospitals and job fairs, you can be able to get people who will be able to network with you. They'll be able to support you and give you all the and support and give you and put you up in the programs and make your career fly and get all the support.
Well, and get all the support that you need. So please,
Yes,
no
yes,
matter the level that you are, for example, you have been in the United States for so long. You started in the nursing back home
yes,
in Africa, Europe, wherever, and now you find yourself here in the United States after 4, 5, 10 years, and you're thinking, is this really for me?
yes.
Organizations such as the Global Fatherhood Foundation is here to assist you every step of the way. And the fact that they will even help you with daycare for your children, if that is what is going to prevent you from taking the program, they will help you with that, and other benefits, and of course resources that are also available. If you have any questions, you need any clarifications, or you have any views about this conversation, please, you are more than welcome to leave them in the comment box, and we will definitely talk about it. Of course, at this moment, we'd like to talk about your experience with the enrollment process so far. You mentioned earlier that indeed people are excited, people are calling you all the time to really get enrolled. What has been the experience with the enrollment process, and what will you say is this or has been the success stories for this program?
Well, thank you again, Mr. Colin. Like I said, uh, we working or engaging our community in this program has been successful, but also we have seen some setback, we have seen some hesitancy. There are people who think that, you know what, maybe this is money that it's not a grant, but it is a catch, so I'm gonna have to pay back later.
Oh,
So it is. And some of
wow.
the successful stories I'm seeing, especially like young people, maybe by 28 years old, they are very hyper, they're very much excited with those credentials coming back from the Africa, especially people with the green card. They are coming up on board. They see as an opportunity, because remember, when you come to this country as a new person, there's financial barriers, and you know how, Collins, this career nursing, these careers, the tuition is very expensive.
Mm-hmm.
It's very expensive. Yeah. So when someone is coming to you and they're asking for help, and they're applying for this program, and they go into program, they really appreciate it here, because
Mm.
even people who have been their credentials have been evaluated, and they have to go back, maybe take some classes or take the NECLEX exams. It's all costing money. you know
Mm-hmm.
it's costing money. So and we are paying for this. So
Mm.
so there's so much, and people are happy, the excitement, and I can tell you stories of a young lady today. She almost cried in the office, because
Wow.
she lost her child as a single mother, and nobody told her what happened. And she had promised herself that she's going to work hard, and she's going to make sure that she becomes a cardiologist, and from there on she's going to inspire her community. She's going to make sure that no single women from Africa country who is struggling with a pregnancy goes through what she went through.
Mm.
So yeah, so there's a real story behind it, and excitement about it, and also, yeah, the financial barriers too.
Wow,
Yeah.
awesome. That is amazing. Thanks so much for taking the time to really give us all these updates about the access to Career Pathways
Yeah.
program. Of course, giving hope to otherwise people who felt that they've lost all hope, especially when it has to do with continuing their education in nursing and other health professional programs. And all hopes are not lost. You can be part of this. And of course, throughout the process, you will end up achieving your life dream and the dreams that you have always had for yourself. And even in that, we also want to talk about what I believe has been, or what I will say is the next steps for those who have enrolled.
Mm.
If they have enrolled, we just want to have a picture of the next steps after they enroll, they go through the program. Can you please share with us the steps?
Yes, thank you again. We have okay. The first step process, we do an intake interview. Uh,
Mm.
we sent out application. I review your applications actually in advance. Then then from there we do a pre interview. A pre interview can take two forms. It can either be a physical form, physical, whereby you come to office, or we can do through Zoom.
Mhm.
So it depend with where the participant is. Secondly, we make sure that you are compliant. The
Mhm.
application failed. We have a copy of your ID. You have
Mhm.
a security card, and also when you're doing the application, you have to sign a letter of release.
Mm.
A letter of release enables us, if you're in school, you're doing you're taking some classes, I need to contact the school in regards to your uh, tuition, or
Mhm.
uh, Yeah, in kind of your tuition. Secondly, also too, we have to make sure that we are compliant with the federal guidelines in regard to income. And most of these people, most of the participants coming in this program, they are working part time. Only a few are working part time, but most of them are working part time. Also, we have to do some activities called we have to review your need assessment.
Mhm.
To look at your career counseling, and also we have to help you up with the individual plan development. We also for talk about credential evaluations, the process. We have a company there's a which is state certified. They are called WES, West
Mhm.
Education Services. We use them for evaluation of the credential services. And what I'm saying is this: when they evaluate your credentials, we actually we you pay fast. When you pay fast, then we refund you the money. We refund.
Mm.
But if you don't have the money and you are stuck, we pay for that. Then also for those people who have also enrolled and they're enrolled and they want to go, they're enrolled and they've been evaluated, and then they apply for the NECLEX exam with the Minnesota State Board, nursing board. What you do again, we pay for them.
Wow.
Yeah, it's about $200. I commit myself, and then they study. If you're studying and they need other resources like a computer or they need some few books, they'll tell me what they need. Most of them, they're okay. They're telling me they just need a few things. They have a computer, but they just need resources. And I
Mm.
provide those resources, and they buy books, and this can be able to help them.
Wow, that's amazing. Thank you so very much for actually explaining the steps
Yes,
that are involved when somebody gets enrolled, and then also the kind of resources and help that is available for people who get enrolled. At this point, we want to know what's the plan for job placements? Even though we've kind of touched on it briefly, we want
yes,
to know and want to give people the assurance that if they go through the program with
yes.
regards to job placements, they are highly, highly assured. Please, if you can tell
Yeah.
us the plan for job placements for the people who go through the program.
Thank you. What I want to say, okay, let me go back just a few things, if you don't mind. On the need assessment, I talked about the activities. We have a need assessment, career counseling, and also we help the individual plan development. We also
Mhm.
have an employment plan whereby we for people. For example, we have three people. I think six people.
Mhm.
They will be exiting this program this end of December. So my goal will be to look for, as a navigator, our job is to connect this participant with job opportunities. Yeah, you're
Mhm.
going to have a job fair, opportunities in-house, the Brooklyn Park Community Center. However, also with the navigators, with this job, with these hospitals, we are already connecting with the HR.
Mhm.
With the HR, and we'll be able to forward some of the names for the people in this program, so they can go and apply for job at these facilities. Yeah.
Wow.
Also, I wanted to understand one more thing with the role of this program. Again, we want, even after they exit the program, we'll still follow up with them. I'd like to know what has been going on. I'd like to know what other services I can offer other than what I have. I can be able to
Mhm.
connect them with other resources in the community. I
Wow.
can be able to reach out to nursing professions
Mhm.
or organizations and connect them and connect them. For example, Metro State has got a very nursing program. St. Kate has got nursing program, and my goal is I don't want them to stop here. I would like them to continue with their career. I would like them to advance to BSN. I want them to become cardiologists. I want them to become doctors practitioners, because that is how we help our community.
Mm.
Yes, and because these people, they're still young. They're still young. There is a drive to succeed.
Mhm.
So yeah, so we all the resources working with these hospitals, and that is one of the placement opportunities that we are helping up with the participants. Yeah.
Wow, that's great. Of course, you are very much dedicated to helping people to
Yes.
succeed, especially when they get into the program. It's not all about the entry level.
Yes.
Mr. Mwangi and his team at the Global Fatherhood Foundation want you to succeed. They want to help create a champion from every home, especially for those who would like to get enrolled in the career pathway program. And of course, before we get this conversation to a close, what we want to find out from you is that are there any other areas, any other updates that you would like to share with us going forward, and what is the next steps?
Well, thank you again, Mr. Collins. Wow, I just want to say I'm so much excited about this program. Uh, and when you see people coming through that door, their worries, and then they leave, they're happy, then they call you back, they tell you thank you from the deep of their heart. You know that we have made a difference here.
Right.
Yes. So, due to outreach, last week, I think the last 2 weeks, we have gone to colleges, we have gone to some few worship centers, we have gone to schools, we have gone to what do you call community centers. We have left some flyers there. Uh, we want our community to take advantage of these opportunities.
Mm.
The international healthcare is wide. You don't know is wide. So there are so many options here. Healthcare classes are very expensive. The state of Minnesota is giving you an opportunity. It's giving you an opportunity to go back to school. Even those people who have been away for 10 or 5 years, please, you can still rekindle your passion, to be that nurse, to be that doctor you have always wanted. And one thing I want to say also too, let's be honest about it. These positions have got high income. This will be
Oh
able to
yeah.
is be able to help your household. You can be able to take a nice vacations. You can go back to your home country. You can spend time with the kids. You don't have to work two jobs. So that's the good thing about this program. So lastly, contact us anytime here at the Global Fatherhood Foundation. We are based in Brooklyn Park. We will guide you. We will give you the support. We work with you with passion, and we'll be there successful for you. So anytime, call us. Sometimes I come over the weekend. I'd like to work with your schedule, you know and we have transportation also where you are. If you're taking a bus, uh, if you're stuck, I can come pick you up. We have a van where I've seen some people that get stuck, and I can come pick you up. You can come through the application, we can do the pre-interview, then we can send you back home safely.
Wow, that is amazing. And thank you so very much for taking the time to
Mhm.
talk, excuse me, to talk about this program. But if you actually need more information, just actually get a screenshot of what you see on your screen now. You can crop me out. You can crop Mr. Imwangi out. But this information, the fly is so important. And you can actually call the numbers on it, 763-205-9643. Actually, it's one number, 763-205-9643. Or you can actually send an email to the Global Fatherhood Foundation on
Yeah.
gffmentor@gmail.com. But that's, you can go to their office, you can call them, book an appointment, or you can actually just walk in. Yeah, you
Yep,
can just walk in. If you happen to be in Brooklyn Park, you can just walk in and say, please tell me about this program, and because I'm interested, or because it can help somebody that I know, and they will give you all the support that you need. We want to raise champions in homes. We don't want you to be stuck with that job that is killing you gradually. You hate it because it doesn't pay you well. The nursing, the health professional has opportunities, and more so for people who probably, for one reason or the other, could not continue their nursing program or journey. But now, this is an opportunity for you to succeed. Thank you so very much, Mr. Imwangi, for
yes.
being on the program. Is there any last word before I let you go, please?
Well, I think we have spoken, and we have done all the outreach in the community. So the goal is there for you. If you're living in Minnesota, please take this advantage. Don't hesitate. This is a grant money, a money to see that you're successful for you. So I want to say thank you again, Mr. Collins, for this opportunity, and thank you so much for the work you do in the community. You are a real asset. Thank you, sir.
Thank you so very much. We are excited to do this. We are excited to help create champions in homes and to bring resources to communities and homes and to everybody who need it. Once again, thank you so very much, Mr. Imwangi, for joining the program.
Thank you.
All right, this has been African Let's Talk. And of course, we have been talking about increasing access to career pathways program. And you've heard the conversation. If you missed any part of the conversation, you can always go back and listen to the conversation and see how it can be of help to you and for somebody who needs this. Thank you once again. My name is Collins Kofi Opon. Have a good night.